Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Acalabrutinib vs Ibrutinib, how do they compare? Acalabrutinib, a treatment for chronic lymphocytic leukemia, CLL, appears to have a lower risk of adverse events, such as atrial fibrillation, in comparison to Ibrutinib. A 2021 Phase 3 study in the Journal of Clinical Oncology found that while both medications have similar efficacy, Acalabrutinib was better tolerated with fewer side effects. In clinical studies, in comparison to Ibrutinib, Acalabrutinib was associated with an overall lower occurrence rate of hypertension, diarrhea, arthralgia, atrial fibrillation, back pain, urinary tract infection, muscle spasms, bruising and indigestion. In comparison to Ibrutinib, Acalabrutinib was associated with an overall higher occurrence rate of headache, cough and fatigue. A grade 3 or higher infection developed similarly for both drugs. 30% of Ibrutinib patients in comparison to 30.8% of Acalabrutinib patients developed these infections. The most common serious side effects for both Acalabrutinib and Ibrutinib were found to be anemia, pneumonia and atrial fibrillation. Researchers have found that Acalabrutinib is a more selective Brutons tyrosine kinase, BTK, inhibitor. The way that both Acalabrutinib and Ibrutinib work is by irreversibly binding to and destroying the cancerous B lymphocytes. Acalabrutinib's increased selectivity means that the risk of off-target cells, or non-cancerous cells, is much lower than in Ibrutinib, which thus results in a lower risk of adverse effects. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.